Gather supplies. Check Picc baseline measurement information. Explain procedure to patient and family. Clean workspace with hospital-approved disinfectant. Perform hand hygiene. Position patient and place chucks under extremity to isolate extremity from bedclothes. Secure IV lines to prevent pulling on catheter during dressing change. Apply mask on patient. If not tolerated, instruct patient to turn head away from catheter site. In obtunded or ventilated patients, position head away from line. Open kit, remove and don mask. Perform hand hygiene. Don first set of gloves in dressing change kit. Remove and discard old dressing and CHG patch. Remove dressing from below insertion site towards axilla so Picc is not pulled out from insertion site. Secure Picc line by placing a finger over the dressing on the line as you remove. CHG patch may stick to dressing. Be careful not to dislodge catheter.
I'm gonna have you move your arm up, sir.
Inspect site for redness, swelling, or drainage. Remove adhesive securement device if present. Secure IV lines to prevent pulling on catheter. Disengage device. While holding both sides of device, use one thumb to lift the door open while the other hand stabilizes device. Repeat on other side. Carefully lift and pivot catheter to the side without dislodging it. Lift one edge of device, applying liberal amounts of alcohol to dissolve adhesive and remove device. Remove gloves and perform hand hygiene. Open and place securement device onto sterile dressing kit field aseptically. Don second set of gloves in kit or a pair of sterile gloves. If patient is allergic to chlorhexidine, or if there are signs of skin irritation or breakdown, use povidone iodine swabs. If site has gross drainage or is crusted, use sterile saline, saturated gauze, or sterile saline wipes to cleanse area. Remove chlorhexidine swab sticks from kit and open. Using repeated back and forth strokes, creating friction, disinfect area with chlorhexidine skin preparation for a total of 30 seconds of continuous cleaning. Include top, bottom, wings, and hub of Picc. Take care not to dislodge catheter. Allow to completely air dry. Do not blot, fan, or wipe away. If not allowed to dry, skin breakdown may occur and dressing may not adhere. If skin is intact, allow to dry for 2 minutes. If skin is not intact, allow to dry for 5 minutes. If patient is allergic to chlorhexidine, use povidone iodine swabs. Cleanse area with a circular motion working from insertion site to 2 inches outward. Repeat times 2 using a new swab stick each time. Allow to air dry completely. Remove povidone iodine by cleansing with normal saline wipes or by using a sterile saline syringe and squirting sterile saline onto clean wipes using the same circular motion. Allow to completely air dry. Apply skin prep to ideal device site, which should be away from anacube space to minimize catheter movement. Allow to dry completely. Align device so directional arrows point towards insertion site. Gently lift catheter so wings are in the device. Place 1 suture hole over 1 post. Repeat for other side. If post slide, position second post until it is in the suture hole. Carefully close door between finger and thumb, one side at a time, taking care not to dislodge one. Keeping proximal side down on skin to stabilize catheter. Place device in position and peel paper backing away one side at a time to adhere. Confirm external length of catheter is unchanged from baseline by counting marks along length of catheter. Starting at catheter hub, count exposed line marks with the first marking from the hub counted as 1 centimeter. Apply barrier film to area where border of dressing will be applied. Allow to completely air dry. Apply CHG patch around catheter in full contact with skin, blue side visible, with slit in line with catheter. Apply sterile transparent dressing. If patient is diaphoretic, has skin breakdown, or if site is oozing or bleeding, dress site with Tegaderm HP dressing. Utilize included tape strips to secure site where catheter exits the dressing. Ensure a totally occlusive dressing by placing a tape strip over the transparent dressing, but under the catheter at site where catheter exits transparent dressing. If using a non-traditional dressing, as an opsite or cover roll, the supplied tape strips may need to have a notch cut to allow it to snugly fit around catheter dressing exit site. Reapply barrier film on top of edges of dressing border. Secure IV tubing with tape to make a stress loop away from catheter insertion site when indicated. Remove and discard gloves.